Hello, my name is Juliet. I'm going to be your student nurse for today. I'm going to be doing your postpartum assessment. How are you doing today, Kat?
Good.
Okay, good. I'm going to go ahead and start with your vital signs. Get your O2 there. Take your temperature. 97.8, that's good. 97%, 62 pulse, perfect. Take your blood pressure here. 122 over 78 looks good. Okay, so I'm going to go ahead and begin with your breasts. I'm going to have you expose one at a time. That way you're not completely exposing yourself to me. I'm going to look to see if there's any abnormal tissue, any lumps or bumps, and then I'll go ahead and palpate. First, I'm just going to check the symmetry. It's normal for women to have asymmetrical breasts, however, yours are symmetrical. So I'm going to go ahead and palpate counterclockwise. So I'll go around, make sure there's no lumps or bumps or anything like that, nothing unhealthy there. How do you feel breastfeeding is going?
Good.
Okay, and then go ahead and check out your uterus. I'm going to go ahead and cup right here. You did not have a C-section, so there's no incision there. I'm going to cup here, and I'll start from your xiphoid process, and I'll palpate downward. Your uterus should feel hard like a softball, which it does. Any softness could indicate infection. If it was to the side, it would indicate that your bladder is full and you need to urinate. However, it doesn't feel that way, so I think you've been urinating often. How often have you been going?
I've been going pretty frequently.
Okay, that sounds good. We just want to make sure that all the fluids that we gave you are coming back out. Your ionos are normal, so that's good. There's no tenderness, so everything seems fine there. And then your bladder was fine. You're going to the bathroom, so that's good. Do you think you went maybe about like 150 milliliters? Okay, that's good. That's good. All right, I'm gonna go ahead and ask you some questions about your bowel movements. Have you had any since birth? No? Okay, that's okay. From 3 to 5 days, that'll be normal due to hormone regulation if you don't have a bowel movement. However, once we get to that 5th day, I'll ask you again to see if you've had any, and if not, we'll go ahead and increase your fiber and probably put you on some constipation medication just so we reduce your risk of getting hemorrhoids because it can be adding more discomfort to what you probably already feel. So I'm going to go ahead and turn you onto your side. You can come this way. That way I can assess epicystotomy. I'm going to check out to see if your vagina is okay. If your labia is swollen, I'll give you an ice pack. So now that you're on your side, I'm going to go ahead and assess a few things. I'm going to see whether you have first, second, third, or fourth degree laceration. I'll get you any pain medication if you feel like you need it. So the wound should be dry and clean, so everything looks good. Has your pad been filling with blood more than in an hour? Like, has it filled
No.
past an hour? Okay.
And I've noticed a decrease in the blood.
Okay, that's good. That's perfect. That's what you should be expecting. Have you noticed a color change?
Yes, as well as a color change.
Sounds perfect. Okay, so that looks good. I'm glad about that. So you can go ahead and come back this way. So what I'm going to do now is I'm going to check for deep vein thrombosis because that is something that could happen. So I'll go ahead and support you here. I'm gonna bring your leg in. Do you feel any pain?
No.
No? Okay. No pain as we go back down?
No.
Perfect. Okay, so you don't have any signs of DVT, which is good. We don't want you having any blood clots. I'm gonna go ahead and make sure you have no edema in your legs or in your feet. That would be not too good, but it's okay because you don't. You have nothing to worry about. I'm also going to palpate your pedal pulses. I'll go ahead and check this one. And they're both even, so that's good. Okay, so I'm going to go ahead and ask you some questions about how you're feeling today. Is this your first child?
Yes.
Okay. No other children. Are you from here?
Yes.
Okay. And your family's around?
Yes.
Okay, so you have support and your husband's here?
Yes.
So that's good. Okay, so you have a support system, that's good. And you're feeling okay. Are you excited about your first child? You're super excited? That's good. I'm glad people usually are. So I'm just gonna encourage you to take care of yourself. If you notice anything abnormal, if you're feeling any different, maybe a little bit sad, open up, talk to us about it. We can help you with that because postpartum depression does happen sometimes, but you seem to be doing okay. All right, so I'm just going to make sure that you're up to date on your vaccinations, and it seems like you already have your RhoGAM and your rubella. So that's good. I'm glad you took care of that. So that's pretty much it. Oh, just kidding. That's not it. Oh, you're up to date on your flu as well.
Yes.
So that's good. If you weren't, then I would be able to give you that and your Tdap as well before we discharged you.
Okay.
Okay. So you look good. Everything's good. Do you need anything else? Perfect. Well, I'll see you in a little bit. I'm gonna go chart.